Hi, welcome to today's Telehealth Secrets webinar, Building a Chronic Care Management Program that can Scale. Before we get started, just a few quick housekeeping items. This session will be recorded. Recording and slides will be sent out later. You can also download a copy of the slides now from your handout section. If you have questions anytime during the webinar, please use the chat box to send them in. We'll be pausing at different points during the presentation to answer your questions. Also, we're excited to announce that we'll be exhibiting at the ginormous HIMSS Health IT Conference, March 15th through 18th at Disney World. Oops, did I say that? I meant Orlando, Florida. Schedule a time to meet with us there. I've put a link in the chat box where you can request a HIMSS meeting. Finally, you can check out any webinars you've missed at vsee.com/secrets. And now let me pass the time to our guest host, Thomas McGeough.
Thank you, Anne. Thank you for everybody who are joining us today. Welcome to Telehealth Secrets. This is where we explore and talk about all things telehealth. Super excited about the topic today. And I'll just introduce myself. My name is Thomas McGeough. I'm one of the directors of sales at VSee. VSee is a telehealth company. We work with companies such as McKesson, DaVita, Optum were used on the International Space Station, and we've been chosen for the upcoming Artemis moon missions. So super excited about that, and we're proud to serve our clients, both large and small. So joining us today is Dr. Ajay Gehlot, CEO of CareConnect Health. They are a leading provider of primary care in the state of Georgia. CareConnect, I believe, started with VSee for telebehavioral health, then added a tele-urgent care module, and they just continue to move forward with their telehealth initiatives, and that kind of brings us to where we are today, and that is to talk about Chronic Care 360 and the management program. Dr. Gehlot, he's been a driving force in adopting technology at CareConnect. He's helped grow that organization from 3 primary care offices in 2005 to over 40 offices today. I think that's super impressive, tremendous growth. Congratulations, doctor, for that. And we always like to start with a fun fact to get things going here. Something you might not know about our guest today is he is a long distance runner, and he's an avid gardener, but he's not just any gardener. He's an avid rose gardener. I'm speaking to you from Portland, Oregon today. We're known as the Rose City, so I think that's kind of a cool connection. And we're not just talking about a rose bush or two. We're talking 50 varieties at least from around the globe. Dr. Gehlot gives talks on roses, and I think that's just a good way to get things going, Doctor. How did you get into rose gardening?
Thanks, Thomas. I've been, as you said, I'm extremely busy with my work. And the only way I can relax is to go out and be in the yard. And that's my relaxation technique. Instead of a yoga or a meditation, that's how I relax. And naturally, roses have attracted me from childhood, and I just got into rose gardening.
Very cool. And you obviously live in a great state for that, probably when it comes to Georgia. Probably gives you the opportunity to grow all sorts of things there. So thank you for sharing that. And I think with that, we will go ahead and hand the controls over to you, and we can really dig into the chronic care management program that you're developing there.
Thanks, Thomas, and welcome everyone who's attending the webinar today. We actually started working with VSee 3 years ago, and beginning of last year, we came up with the concept of a comprehensive chronic care management model through telehealth, and we started working with VSee, and by October, they delivered us the application and the app, and we're going to talk about it today. So there are 5 pillars of chronic care management in an ideal situation, which are self-management support, delivery system design, decision system, clinical information system, and organization of healthcare. So how have we been able to close the gap? Because all these years, all the pillars I mentioned have existed, but there were so many gaps. And through Chronic Care 360, we have been able to close the gap between all those 5 pillars. And today, as you can see on my slide, through Chronic Care 360, we use it for remote patient monitoring, chronic care management, and virtual visit for these same patients who have chronic diseases. But today, we're going to talk more about RPM, remote patient monitoring, because CCM and virtual visit are really separate topics, and I will kind of demonstrate how Care Connect has been able to close the gap through RPM. So through RPM, involving the patients, because patients can see their own vitals, their own data on their own mobile phone, and we as providers can see it in real time. So that way, the goal of the self-management is the patients become true partners and effective managers in their own care. And the gap about the delivery system, it's a real-time information. The moment a patient puts a blood pressure cuff on his or her arm and takes the blood pressure, not only the data is available in their mobile device, but in real time, we can see it at the back end. And because patients are aware what's going on with their wellness, with their health, and we are aware what's going on. So anytime we make a decision about their chronic disease, it's a shared decision making. And because this app is being used for management of chronic care, we are developing a huge registry of all the patients who have chronic diseases like hypertension, diabetes, COPD, asthma, and weight problems. And naturally, all these things align with our quality improvement. And that's how we are closing the gap, which existed till now between the main pillars of chronic care management and the patients. And this is our app, which we have called Chronic Care 360, because really we are doing remote patient monitoring for a host of chronic diseases, not just one particular disease like blood pressure, which is the commonly used remote patient monitoring disease. And this app is available to download on the App Store as well as on Google Play. So in today's webinar, I'm going to talk about the benefits and challenges of the program, what devices are connected, what is the perspective of the patient, and what's the perspective of the provider when they are using Care Connect Chronic Care 360, who are our team members, and what's the workflow to make this very effective and efficient. And I'll briefly touch on the billing part, because that really should be subject of a separate webinar. So to start with, the benefits of RPM are very obvious. I'm not going to go into details, but certainly they improve the quality of care, which results in better patient outcomes. It's real-time management. And because of this, there are reduced readmissions and ED visits. So the traditional way of treating chronic care diseases has been that once kind of patient is stabilized, the provider feels, then the patient is asked to come back in 3 months' time. Let's take an example of a diabetic patient. Once the provider feels that all the medications have been stabilized and the blood glucose and A1C are stable, they ask the patient to come back every 3 months. So when the patients come back after 3 months, what we are looking at as providers is just one snapshot during that day, during that hour, or during that time period they are in the office. We don't know what happened during the 3 months from the last visit and today's follow-up visit. But with Chronic Care 360, we can actually see what's going on in between, because there may have been some abnormal readings, or the blood sugars have gone too high, maybe for 7 or 8 or 10 days, and nobody knows. And sometimes these things lead to emergency department visits or admissions to the hospitals. As primary care providers, we come to know about these things after a catastrophe has happened, not before the catastrophe has happened. With RPM, we can look at the trend. As soon as we see an abnormality in the trend, through the app, we can contact the patient either through message, email, phone call, virtual visit, and find out what's going on. Maybe it was around Christmas, a lot of sugar consumption going on, and that may have led to a peak in the blood sugar levels on a daily basis, which is okay. But there may be other things. Maybe patient has changed his or her diet, and that's not good for stabilizing diabetes. So we can really figure out what's going on if there is any abnormality in the trend. And it's a very, through the app, the access to care is very easy. The patients don't have to travel anywhere. They stay at home. Our providers stay in the office, and we can communicate, monitor, and talk to them, advise them, change the prescriptions, or change their medications. So access to care from a patient's perspective is very easy. And whatever I said just now is validated by one of these surveys, which was done last year on 300 patients who were in. It wasn't done on our patients, but this is one of the studies I found where 300 patients were enrolled in remote patient monitoring, and the survey showed the validity of whatever I just pointed out, that 43% of the patients found it a lot more convenient than going to a primary care office, and that was a major benefit. 39% said efficiency, 37% said that they had more control over personal health. And that's what self-management support is all about, that the patient needs to have a better control over their own health, and they need to be more involved in the shared decision making. So 37% of the patients cited that they had better control, more control over their personal health, and 36% said that they have peace of mind because they themselves also know every day what's happening with the vitals they are monitoring. And what are the challenges of RPM? Again, they are very obvious. Data security is the first and the foremost, that any data which is recorded in patient's mobile device and transmitted over to us, it needs to be secure and encrypted. The second one is the data accuracy. It needs to be accurate. Otherwise, really, it does not do any good, either for a provider or a patient. And the third one is the system integration. What I mean by that is that by now, probably 99% of the providers in this country are using some kind of a EMR at least. So the app or the data we collect through RPM needs to be integrated into the EMR, so it goes into the patient chart. Now, to be honest, we haven't integrated our Chronic Care 360 app into our EMR. The other concern, and I'll talk about it later on, the cost of devices, because that's something which creates or causes or makes patient feel that that may be a barrier. Who pays for the devices, and how much will they cost? And lastly, of course, the interface of any app needs to be really based on the user experience, that how easy it is to maneuver, manage, and change. So these are the technology challenges of RPM. And again, on the same survey, these were the concerns expressed by the patients, that they were concerned about the accuracy of the technology, the reliability of the platform, and the cost of care. And cost of care really comes into play because of the cost of devices. So I'm going to present a short video that which Bluetooth devices we connect and configure to talk to our Chronic Care 360 or collect and transmit data to us. Okay, so that was the video. We just wanted to demonstrate how easy it is to connect these Bluetooth devices to our app on a cell phone. And there are two things I'd like to point out. One is at the moment, there is no Bluetooth at home device available for hemoglobin A1C, but patients can always enter the data manually. Any of the data can be entered manually too. But for others, except for A1C, Bluetooth devices are available and they connect to the mobile phone. And the second one is that the patients don't really require internet. What I mean by that is everybody nowadays carry a cell phone, which is already connected to their carrier. So at home, people don't need to have an internet connection or anything, because once the Bluetooth devices are connected to the cell phone, the data is transmitted from their cell phone or a tablet or any mobile device directly to us. So these were the two pertinent points I wanted to make. I'm going to just quickly go through what the screen on a cell phone looks like from a patient's perspective. And so this is the first one, shows that's the home screen, which shows Chronic Care 360. And if you go at the bottom, I'll go through the icons at the bottom. So that's the home screen. The second one is the chat. So patient can anytime text or chat with the provider. And as you can see, kind of Sarah Michael is our provider, and she's saying that I'm available to do a video chat now, or maybe a text chat. The third icon at the bottom is the visits. Any video visits done for these patients will be in the past visits. And as you can see, this patient had a past visit on October 1st, 2021. And any upcoming visits will also show up on if pressing the upcoming on the top. The next screen is the health, if you can see at the bottom. And that's where the patients can see their health dashboard and documents. And this is the last icon on the bottom is the profile, which is really a kind of the demographic information, what's their address, phone number, date of birth, gender, street address, and I'm not going to go into next screens on this one, but their pharmacy name and other things are also listed. But what I want to show you here on the profile is that's where clicking add new device or manage activity trackers lets patients or our coordinators configure and connect a Bluetooth device. And I'm going to show how it looks on the patient screen. So this is the same screen which was on the last slide, which is add a new device. You click on that and our app will show either a well-challenged device, iHealth or Apple Health. Because we use the blood pressure monitoring cuff from well-challenged and rest of the devices are from iHealth. And if they need to connect to a blood pressure monitoring device, sorry, my screen is playing up here. Okay, sorry. Let me go back. I'm sorry about that. Okay, so they select the blood pressure device. It will show up on the screen that this is the blood pressure device which can be connected, and connect now can be pressed and the device is found. It's like connecting your cell phone to any Bluetooth device, and that device is connected. The name will be here, blood pressure RPM, the model number and the device ID. And then on the next screen you can do another device, which is add new device. So you can connect as many devices as the patient needs or wants based on their chronic condition. And on the health part, I showed you two things. One was my health dashboard and documents. So if a patient presses on my health dashboard, it'll show up the data they recorded today, which is the weight, blood pressure. We haven't connected it to an iPhone or sorry, not iPhone, Apple Watch or any of the steps trackers or activity minutes, but that can be done. Blood glucose, pulse, and again, I'm duplicating the screen because I didn't have much space, but hemoglobin A1C can be manually entered. And the temperature and the pulse ox readings are all here. So this is the health dashboard the patient can see. Now, they can not only see the readings for that day, which was October 1st, as you can see on the top, but they can see the trend for a week, for a month, or for their lifetime they've been using it. And on the home screen, they can also schedule an appointment if they have a question or they are not happy about something or they are concerned about something, and they can book an appointment with the provider. And once they book the appointment, they get a confirmation email either through email or text based on their preference. But on the home screen, it shows that their appointment is confirmed. And when next time they open the app, it'll show up that they have an upcoming appointment with the provider on such and such date at such and such time. So this was the patient's perspective. And Thomas, if you have any questions till now, I'll be happy to answer them.
Let's go ahead and just keep moving on since I think we're running a little bit short on time.
Okay. I'll try to be a little quicker now. Okay. So the second part of the presentation is the provider perspective. What do we as providers see? So this is the dashboard for one of our providers. And you can see, naturally, this is kind of for a demonstration purposes and to keep the HIPAA requirements, we didn't really do the screenshots for our whole patient population, but we kind of got 3 of our staff to act as patients and take all the vital readings. So, but this is how the dashboard looks like. That blood pressure risk, there are 3 patients. So 2 patients are normal, 1 is a medium risk. Blood glucose risk, it'll tell you out of 4 patients or 3 patients, how many are normal, how many are at high risk. So it gives you percentages. So at a glance, you can see what your patient population is doing for each chronic disease. Now, if you can click, like on, I've shown that if you click on this red segment, which is the high risk, it'll bring up the patients who are at high risk for blood glucose. So it brought up these two patients who had the blood glucose of 160 and 145. Same way, you can click on any colored segment and it'll bring up the list of the patients, whether it's orange, green, or red. Here I'm showing that by blood pressure risk, click on the orange. It's only one patient who's at medium risk, and it'll bring up the patient here who's at the medium risk, and you can see why they are being classified as medium risk. Once the provider realizes that there is a problem, then they can click on the patient and really go into the details about the patient. And on this screen, I'm showing that you click on health, and it will give you all the data this patient has recorded today for this day, which is the blood pressure, heart rate, blood glucose, blood oxygen, weight, active minutes they logged in manually, temperature through thermometer, and because they didn't do A1C, there is no data here. And not only you can see it for today, but you can start looking at by week. So for this patient, we can see the trend, what's going on with the blood pressure, what's going on with the pulse, and what's going on with the blood glucose. So you can see the blood glucose is slowly creeping up in the later part of the week. And then you can really go into the whole data for the whole month, and it'll show in a graphic view what blood pressure has been doing for the month, what pulse has been doing, what glucose, and all other vitals can be looked at on a monthly basis. So that kind of helps us to recognize if there is any abnormality in any of the trends. The data is monitored every day by one of our telehealth coordinators. Anytime she sees any abnormality, she informs the provider, and then provider looks at it and then go from there. But the data can be tracked on a daily basis, weekly basis, or a monthly basis, or a yearly basis. And this part on back end shows if this patient has had any visits, and it'll show up the visit history here. The next one is any documents. Let's say the patient went somewhere and got some labs done. They can always take a picture and upload it through their cell phone, and it will be deposited here. Not only patient will have access to his or her own labs or any other data, but even we as providers will be able to see what's going on, or what the labs are, or what is it that patient wants us to see. And this is the time log. So every time the provider goes in and either monitors the data or interprets the data or does a virtual visit, there's a timer, and in the next screen I'll show how the timer works. But you can see that the provider can enter the remark what they were doing. So here it was for 13 seconds, it was provider reviewed the blood sugar data. And on the next line you can see Sarah Michael reviewed this for 4 minutes 30 seconds, and that was what she was doing, was assessing all vital health indicators. And so here is the timer in the right hand corner in the red here. So anytime the provider is doing anything with the data, assessing, monitoring, or doing a virtual visit, it starts logging the time. Because from a billing point of view, for remote patient monitoring, CMS has some requirements for the time, and that will be really kind of charted here, and it's for the documentation purposes. And anytime you are audited, the auditors can see that what you submitted as a CPT code was based on the time. And lastly, one more thing I wanted to kind of share with you, that not only the patient can schedule a visit, but based on the data, the provider can also invite the patient, and that's where it starts, create new visit. So a provider can initiate a visit and invite a patient to have a virtual visit. So that way, everything is just digital. There is no phone calls to be made. Everything goes really electronically. So that was what we see at the back end. And I'm going to stop here again for a few minutes if there are any questions on this segment.
I think we can hold the questions to after the workflow part.
Sure, okay. So who are our team members at the moment managing the Chronic Care 360? So at the moment, we've got 42 offices and 150 providers. So really the way we have worked it out at Care Connect is that we have centralized everything. And I'll go through the workflow in the next segment and you'll be able to understand how we do it. But she is the one who really looks and monitors and interprets all the data and does all the virtual visits for all chronic care enrolled patients in the app. And these are the 4 members of our team. Bridget is our clinical manager, Tristan is our project manager, and these 2 are our care coordinators. And you'll understand why I pointed these people out on the workflow. So this is the workflow we have done it. We have kind of implemented because we have 42 offices, and this workflow works at all these places, and everything is managed centrally through our command center. So let's say a patient comes to one of our offices and is seen by the primary care provider. Patient has 1 or more chronic diseases. So our primary care provider discusses the benefits of Chronic Care 360, and let's say patient agrees to enroll. So that time, patient is given a prescription that which devices this patient needs to be connected and configured for. Let's say patient just has hypertension. So the only thing based on provider's prescription, it will be only a blood pressure cuff, or maybe excuse me, the same patient has weight problems and blood pressure, then a scale will also be prescribed. So based on the chronic condition or chronic disease the patient has, the provider writes a prescription. And again, CMS requires that these devices need to be ordered by a qualified healthcare provider. And we call it a prescription. And once the prescription is given, before the patient leaves the office, patient is given another appointment to come to the same office with their mobile device. And that appointment is conveyed to our telehealth coordinator. And the coordinator then really travels from the command center to the office based on the time of the appointment. So that day, let's say the patient came in today, or patient came in 2 days ago, was given an appointment for today to come and get the app and the devices. So the patient will arrive today, and our care coordinator will be there to work with the patient. So the patient needs to bring the prescription and their cell phone or mobile device or a tablet. In case they lose the prescription, no worries, because a copy is scanned in their EMR part. So we can always kind of look at their prescription, which is scanned in the EMR. Then the telehealth coordinator, and again, majority of the patients we are dealing with at the moment are older or elderly, and they are not afraid, hesitant in using the technology. So our telehealth coordinator actually downloads the app on their cell phone and helps them open the account. So there is somebody guiding them, working with them to open the account, put in everything in there to have the app work. And based on prescription, the coordinator then configures and connects the Bluetooth devices. Patient is then educated about using the devices correctly, recording the measurements, and using the app. And then patient leaves with the devices. So that way, we have done the training, we have done the setup, and we have educated the patient, actually shown them in case they need to have a virtual visit, how it can be done, or they can be they are trained to, or they are educated that in case there is a problem, we will get in touch with them either through a text or through an invitation to have a virtual visit. So patients really are fully aware how the app will work. And we have done majority of the work to download the app and configuring. So really they just have to go home and start monitoring whatever they need to monitor. Like I said previously, that the data is monitored daily by one of our telehealth coordinators who's a nurse. Any changes in the trend is brought to the attention of the provider, and based on the interpretation, either the patient is invited for a video visit or they may be sent a simple text. And in case a video visit is done and the problem seems to be more complex than can be managed through video visit, then the patient actually is asked to go and see their primary care provider in person at their regular office. And we actually, before we ask the patients to see their primary care provider in person, our coordinator actually makes an appointment, because we are on a network, so she can go into any of the office's appointment schedule and make an appointment for the patient. And then she informs that patient's receptionist that she has created an appointment for a patient to come back, and all the data is loaded up in the patient's chart in the EMR. And a small comment is made why the patient is being referred back to the primary care provider based on the Chronic Care 360 findings. So that's the way we have established a workflow. So we have a command center team, which I showed the pictures of, and they work with all the patients and all our 140, 150 providers in various offices. So that's the way the workflow works. And again, these are the simple forms which we are required by CMS. One is a prescription sheet, which needs to be, because the devices or the monitoring systems need to be ordered by a qualified healthcare professional. Patient need to agree and sign a consent form for participation. And lastly, we applied for a FCC grant in 2021, early 2021, actually end of 2020, where the FCC had come out with because of the COVID-19, a broadband and telehealth grant, and we actually got 5,000 blood pressure devices and 2,000 other devices. So at the moment, we are giving all these devices free to our patients. When we are giving them free, we are asking them to sign a loaner agreement. In case they are not compliant, then we tell them that we will ask these devices back because we like to use them on somebody else. So at the moment, we are giving 5,000 blood pressure devices free and 2,000 other devices free to our patients. So one of the concerns we talked about in the beginning was the cost of devices. So for the time being, we are taking care of it, and we hope that in next couple of years, majority of insurances, the payers, everybody will come on board, and they will start paying for the devices. The Bluetooth devices are not expensive. They range somewhere from $50 to $75. None of the devices is more expensive than $75. The last segment I'm going to touch briefly is about the patient enrollment, which is the compliance, and the billing part. So these are the criteria for enrolling patients, and these are also considered compliance, which is from a documentation point of view, if any provider is doing RPM, they need to have a patient consent. The devices need to be FDA registered. The devices need to be ordered by a qualified medical professional. And patients must record and transmit readings for at least 16 out of 30 days. Otherwise, you cannot bill. Not only from a billing point of view, but from a quality of care and continuity of care, really it serves no purpose if patient records and transmits the data just 1 day in 30 days or 2 days in 30 days. Then the whole purpose of doing RPM is lost. But CMS requires that before we can bill for any services, 16 out of 30 days, the patient needs to record and transmit the readings. And the data monitoring can be done by a physician or any other qualified healthcare professional or clinical staff, RNs, medical assistants, based on your state laws. And these are the billing codes. CPT 99453 is for initiating the service, which is the setup and education, which our telehealth coordinator does. 99454 is for data transmission, and 99091 is for data analysis and interpretation, and it needs to be 30 minutes by a provider each 30 days. Like I showed you, that's where the timer comes into play. Because before you can build CPT 99091, you need to make sure that the timer is showing at least 30 minutes of data analysis and interpretation. And if you want to bill for treatment management services, which is for 99457, which is 20 minutes each, a calendar month. And for additional 20 minutes, you can go up 99458. And again, the timer comes into play here because this is the time which will be really doing a virtual visit with the patient. So these are the billing codes. Again, kind of billing is again, there are lots of minor things to keep in mind about these, and I'm not going to go through them today because of the time. But in short, this is how you can bill. CMS is accepting these codes and paying for them. Any questions?
Dr. Gehlot, I thought that was great. I actually lost you midway through the presentation, so it kind of underscores the importance of not having to always have a 24/7 connection to the internet for the program to work. But I'm back now and caught the tail end. I'm looking in the group chat here to see if there's any additional questions. But I have a question initially that I don't think I've asked you. Is there any insight you could give to the group? Because the device space is obviously very crowded. How did you kind of select the vendors that you chose to go with? I think Welsh Allen you're using, iHealth you're using, and then Apple Watch. How did you get there?
There were two things we considered. One was we have worked with Welsh Allen for many years, and the other important thing we considered was the cost of device and how easy it is to get them for the patients. Because at that time when we were working with VSee to design and come up with this app, we didn't know whether we'll be able to obtain a grant or not. So the device cost was a major criteria, or the first criteria we had in mind, and looking at everything and how easy it is from a patient's perspective to order it either through Amazon or directly through the vendors. And we found that even through Amazon, you can order all the devices. And also you can go in on their websites and order these devices. So that was the biggest criteria we kept in mind was the cost. And certainly we wanted to make sure that they are Bluetooth enabled. And thirdly, at least for the blood pressure cuff and glucometer, we wanted to make sure that they were FDA approved.
Got it. Okay, very helpful. Here's a question that came in, which I think is relevant to telehealth because we hear about it a lot. How much time does the providers usually need to spend on monitoring each day? Because I was going to ask it a little differently as far as like how do you how do you control for adding more work to already busy providers?
Like I said, the data monitoring doesn't have to be by a provider. It can be by a nurse or somebody else, and
Got it.
CMS allows you to do that. So we are using a telehealth, we call them telehealth coordinator, because not only they do the nursing job, but they also go in and work with the patient to educate and configure and connect the devices. But it takes, on one patient, it takes at least 2 to 3 minutes a day. Because if things are normal, then really they are quickly, they glance at the graph of or the chart for 1 week and month and make sure that everything is kind of really falling in the range. So I would say no more than 2 or 3 minutes per patient by one of the support staff. Now, if there is abnormality or there is something going on where the trend is going in an adverse direction, then naturally it takes longer, because then she has to prepare a little summary and talk to the provider, and then provider gets involved. And from a so providers are really not looking at the normal data. Unless it's abnormal, providers don't get involved.
Got it. Okay.
Now,
but very helpful, obviously, to have a team approach to all of this.
right now, because we really are in the early phases, so our provider also is looking at them, literally glancing them every day. But again, she's not spending more than 1 or 2 minutes per patient.
Okay, very helpful. Thank you for that. Here's another question from Tom Chapman. CMS requires at least 3 devices, ? Which would they typically be? Scale, blood pressure, and what else?
I'm not aware the CMS requires 3 devices. I've never come across this.
Okay.
So, I'm sorry, maybe I don't know something, but here is something I would like to point out. You may attach 3 or 5 or 7 devices. CMS only pays for 1 device.
Oh, interesting. Okay.
Yeah.
All righty. This could probably be a separate webinar and discussion as well, but as you stated, maybe in the future, insurance may be covering more and more on the device side for the patients. But as far as the initial grant that you guys were successful in obtaining, any just kind of tips or things you've learned going through that process that may help the group?
Right. I'm sure FCC comes out every 6 months to 1 year with the grants for the broadband, internet, telehealth, because that's what I've been seeing. And I hope the trend will continue, because healthcare is, everybody has realized that the technology can be leveraged, and especially during the pandemic, from policymakers to providers to patients, everybody now understands that healthcare can be provided in a better way, good way, easier access to care, more efficient through telehealth. So I'm sure FCC will be coming out with the grants again and again. And then that's where people need to apply to get these devices free. But on a separate note, very quickly, we are actually talking to 2 big payer groups in Georgia, and they in principle have agreed that if their members enroll, they will provide them or they will provide us a little funding to give their members these devices free. So it's just a matter of talking to the payers. So we have talked to 2 big payers in Georgia, and in principle they've agreed that they will bear the cost. Instead of giving it directly to the patient, they would like to give us some kind of a funding in a grant way, without any grant writing, but that needs to be used only for their members to give them free devices.
Got it. Okay. I think that's awesome if that actually happens for you. Here's another one. What are your expected adoption rates / how many eligible patients that you serve have you guys identified?
Okay,
Is this
so
Is this for everybody? Is this for a select group? How do you guys kind of, I guess, triage who this gets rolled out to and offered to?
At the moment, like I pointed out in my presentation, if patient has even a single chronic disease, we are encouraging our providers to enroll them, because we have to get 5,000 devices and at least the blood pressure ones and 2,000. And I want to exhaust them as quickly as possible to make it successful. So really, we are Thomas, can you hear me? Because I think we lost the audio connection for a few minutes.
You know what? I'm glad that wasn't just me this time, because I did lose a little audio as well. But you're back. Okay, we have about 9 minutes. We could probably fit in a couple more questions. I have a question.
Yeah.
Not, and this isn't to imply that what you've already done isn't impressive and super cool, but 2 years from now, what does this look like? Is there an existing gap that you've identified that you quite haven't been able to address due to a variety of reasons, technology or
Yes.
funding, anything like that?
Right. And that's what kind of we amongst ourselves have been talking and really brainstorming. So in the chronic care disease management, one of the kind of things we have found, and I'm sure all other providers and everybody on the webinar has experienced that, is the med adherence, which means people with chronic diseases sometimes don't adhere to their medication in a timely manner, which means there may be a week, 2 days, 5 days, people who are on medications for hypertension, they're not taking it or they're not filling their prescription. So the med adherence is kind of something we are thinking, because to make it really get the best outcome through this app for any patient with chronic disease, we need to have the med adherence included as part of management of the chronic disease. So that's one thing we actually are brainstorming, that how we can come up with something that will work with the same app. And once we have 1 or 2 or 3 alternative plans or tangible plans, we certainly will be talking to you guys at VSee to see whether you guys can make it happen, because you've been a great partner all these years, and I'm sure you will be able to do something and help us.
Awesome. Thank you for the kind words. We would love to do that for you. And let me just throw one more, and then we can kind of do just a finish for the group. I think Anne, our marketing director, who is in charge of all these great webinars and discussions over the years, she always likes to include this question at the end, kind of philosophical. What is the one thing you believe about telehealth that no one else believes?
I don't know about others, but I'm a great believer, and I've been a great believer even when before COVID.
Okay.
And Thomas, you realize we started doing telehealth and doing partnership with you even before COVID actually came. So a lot of people, patients and providers and hospitals and organizations really got converted into telehealth mindset after COVID or during COVID. But we at Care Connect have been great believers in technology and leveraging it to make the healthcare better.
Yeah, I think that's awesome, and I think that's kind of from a market standpoint how, just from our portfolio of clients, you guys are like kind of on the bleeding edge as far as where you're going and what you're looking to do. So it's been super fun for us to continue to support you. Besides that, I have a little closing script here regarding just some housekeeping. First thing, Dr. Gehlot, thank you for the discussion today. I learned a lot. I'm going to listen to this again and just continue to learn about what you're doing and learn as much as I can about remote patient monitoring. Personally, I think it's kind of one of the most important and powerful tools when it comes to getting a handle on the chronic diseases that basically plague our population. So personally, thank you for the time. Thank you everybody for joining. As Ann mentioned in the beginning of the discussion, we will be sending out to all of the attendees the recording and the slides following today's session. And please take our surveys at the end of the webinar. We always like to learn how we can be better. And we hope to see everybody at HIMSS in March in Orlando. And we look forward to having everybody join us for the next Telehealth Secrets webinar. So it's been a pleasure for me, Dr. Gehlot. Thank you so much. If you'd like to say a parting word, feel free.
No, thank you very much for everybody who attended the webinar today. And technology is changing, healthcare is changing, and we need to keep up pace with that to make it better for the patients.
Awesome. Well said. Okay. Enjoy the rest of the day, everybody. Thanks again, Dr. Gehlot. Take care.
Thank you.